Yes.
Is this going to be the wave of the future then for your office? You're getting away from the scalpel flat?
Yes.
You know, it's really great. Oh, let me make this point. I'm sorry these people left because I forgot one thing. And you guys would need to hear this. If a patient comes in and they need a lot of restorative, if they need crowns, if they're having a reconstruction on teeth, they need anything that has to do with biologic width or pocket depth reduction before restorative, I don't use that machine. I use a scalpel because you can't do crown lengthening with a laser. That's really important. I had a guy that came in, he had these big exostoses on the buccal, and the, where's Joy? Is Joy still here? Yeah, that guy who I'm talking about? What's his name, Scott? Or big exostoses. Anyway, so he needed crown lengthening because he was going to have an entire reconstruction done because he had a lot of occlusal and incisal wear. So he asked me if I was going to use a laser, and I said, you're not a candidate. I can't use a laser on you, it won't help you. In fact, I think it might hurt you. So anything restorative, to me, that you need biologic width, you can't use the laser. But to answer the question, I'm using a scalpel less and less and less. And the patients love it. And I got to tell you, I'm thrilled. It's great with me. But you know, it's like anything else. You got to do the right treatment to get the right result. If you have a laser and you do it in the wrong situation, you're not going to get a good result. It's like anything we do.
Why can you not do it? Because you have to do some bone reduction with the biological width?
Yeah, so you can't, let's say there's an old amalgam, and you've taken the old amalgam out and there's some caries, and the caries is subgingival. But you've got plenty of bone. See, by definition, if I say crown lengthening, there's health. All we're talking about is maybe a subgingival location for a broken tooth or caries or something like that. Well, you can't get biologic width with the laser. First of all, you got a healthy situation, and you don't need to use a laser in health. So to get biologic width, you have to use a scalpel, and in my view, you have to recontour bone. You have to get a good long-term result for a good restorative result. And I wish others had heard that, but it's okay. Did someone else have something? No?
What is the investment, the financial investment into this machine?
Large.
Okay. I would expect that.
And worth it.
Okay.
Pardon me? My office is 1 block north of Bay Meadows in San Jose. No. 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 You know where Mediterranean restaurant is? Behind it. You know where First Place Sports is? You know? You run? It's where Bay Meadows and San Jose meet is 1 block north. Very easy.
Well, could we come shadow one day and
Perhaps. Perhaps.
Okay.
Perhaps. Yes.
What do you have your patients do in lieu of not brushing and flossing for 3 weeks?
Good question.
Thank you. Are Chris and Tina still here? You can use chlorhexidine. You can use any mouthwash. You can use any of, you have to tell me the names of your, I get them all confused. What's the name of the mouthwash products?
We have, without fluoride would be your Peroxyl,
Uh-huh.
which is over-the-counter hydrogen peroxide.
Okay.
And chlorhexidine.
Okay.
And then with fluoride would be gel cam rinse or President rinse.
Okay, I would say the chlorhexidine and the Peroxyl, or the Crest mouthwash, or the Listerine mouthwash. Okay, and they do that for 21 days. And the diet, there's a diet for the first 3 to 7 days. Anything you can put in a blender, it's liquids. Okay, 7 to 13 days, it's like flaky fish, baked potato. Then it goes up the scale. We have a menu in the office. I haven't memorized it, but it's like 3 to 7 days, 8 to 13, and then 14 to 21. And then at 21 days, they can brush and eat whatever they want. And at 6 weeks, they can floss. Again, protocol. You know? And I have this all detailed in my office, and I remember, 98% of it, but not all of it. So, great question. Protocol is important. The diet's important, and the not brushing is really important. You don't want to mess with that fibrin I was talking about, the clot. You don't want to mess with the sulcus. You don't want to do any of that. Someone asked about sulcular brushing earlier. Absolutely not. Out of the question. Yes?
Do you ever use the antibiotics on the dogs?
I'm sorry?
Do you use it like Arrestin or anything?
Do I? The only antibiotic, well, do you mean with this? No.
Atrodox or Arrestin?
No, not at all.
Okay.
Not in the least. I will tell you when I use it if you want to know.
Okay.
I use the perio chips for patients who have been in supportive periodontal therapy for years and years, and they might have a localized area, like one area that bleeds. But it's only to calm it down. It's only to kind of make things nice. I'm not a big fan as active treatment. But there's no protocol. Frankly, it doesn't usually work, in my view. Anyone else? And that rep is in here tonight.
What about
Yeah.
Seriostat?
I don't use that. No, I don't believe in long-term antibiotic use. It's not effective for me. But thank you for asking that question. Yes?